As we kick off this year with a fresh perspective, why not give our smiles the attention it deserves? Today, we'll welcome a cosmetic dentist who will dazzle us with her tips on dental care and upkeep. Here to tell us how we can shine brighter this year is Dr. Andrea Joy Smith. Happy New Year, Dr. Smith.
Thank you, Desiree. Happy New Year to you as well.
Thank you. So, Dr. Smith, let's start with the basics. Why is it imperative to get routine checkups with your dentist?
Routine checkups can often identify problems that patients may not be aware of. When cavities first start or when periodontal disease starts, there's normally there's often no symptoms at all. And so if you're seeing your dentist every 6 months, they can identify those problems before they become real issues that are more difficult to deal with.
Yes, and we don't want those really big issues. And what would you say hinders people from fixing their teeth once they find out they need to?
Most often it's fear. Patients that end up with problems that are sort of more difficult to treat have stayed away from the dentist for quite some time. They haven't wanted to go. They do their best to take care of things so that they don't have to go. And then when that thing comes up, they're very reluctant. And often we find that there is fear that is driving that.
Yeah, and we also don't want to prolong and put things off because, like you mentioned, the longer you wait, the more serious the issue can get. Is there a dental option out
Exactly.
there that kind of addresses these concerns if someone does have missing teeth or does want to fix their smile?
Yes, in my office for the last 15 or 16 years, I focus on replacing teeth with one-piece dental implants. It's a simpler procedure. Patients that have been told that they don't have enough bone can receive this procedure. And the day that they come in for treatment, we can actually put a temporary tooth in place
Hmm.
so that they walk in without a tooth or they walk in with a temporary flipper or something that comes in and out. And before they leave at the end of that visit, they can walk out with a tooth that does not come in and out until the permanent tooth can be put in later. But for all intents and purposes, they've gotten a tooth in a day.
Right, and a smile that they're excited to show off. So let's talk about mini dental implants. Who makes a good candidate for that, Dr.
Mhm.
Smith?
There are all types of patients that would be a good candidate for mini dental implants. There are staggering numbers, like there's about 180 million people in the US that are missing a single tooth, and there's about 40 million that don't have any teeth at all. So mini dental implants, especially for those patients that do not have any teeth at all and they have a small amount of bone remaining in their mouths, these patients can benefit because these implants will fit their bone rather than us having to expand their bone or graft their bone for implants to fit in. Other good candidates are patients that are missing a few teeth, like on the lower right side, for instance. If they're missing a few teeth, we can put in an implant bridge. So people that are missing teeth are good candidates. People that have dentures that want to go to something more stable are great candidates. And people that are missing single teeth are good candidates as well.
All right, and people have to go in and have their teeth worked on. They could be a little nervous about that. How do you and your team ease the nerves of your patients when they're coming in for a procedure?
First of all, we approach every patient individually from being a person first. And so we try to develop that relationship with them because long before we look at their teeth, people that have been avoiding coming in particular have are very apprehensive about opening up. So when we sit down and we make that initial connection as from human being to human being, then that is when we make that initial connection. And for patients that are very fearful, in my office, we offer a service called oral conscious sedation. It's a visit that we can give them some oral medications and they'll pretty much fall asleep, although they will maintain their own airway. We don't have to breathe for them, for instance, like an anesthesiologist would. And it's a relatively benign procedure where patients can receive comfortable dental work without the fear and anxiety that normally keeps them away from the dentist.
Okay, see, that's music to my ears when I hear you say that, relieving that fear and anxiety and giving people a smile that they're really excited to show off. Dr. Smith, always a pleasure having you
Yes.
on our show. You can find out more by going to smileagainnow.com.